Hi. So we're back, and we're going to be doing skill 2.3, providing morning and evening care. I'm really going to concentrate on the oral care, okay, with this video, and go over the other aspects too, but the concentration is going to be on oral care for both dentures and for people with teeth. Then I'm going to pause it for just a slight second, and then give you skill 2.4, providing special oral care for a client who is unconscious or debilitated. Okay, so what you're going to do is you're going to gather your supplies. So what supplies do you need in order to perform the skill of providing morning and evening care? Well, first of all, you're going to need you're going to need water, and you're going to need mouthwash. Okay, we'll go into more why in a minute. A brush and a comb, okay? And then your facility may also have something like this. It's called total perineal care, and it's basically 3 disposable washcloths that you can use to wash the perineum area for a resident who may not need a full bath. It may need just a quick wash of the perineum for either in the morning or in the evening. It doesn't matter. You may need a towel and a washcloth, okay, so you'll need those. You will need a denture cup, okay. Make sure the denture cup has your resident's name on it, okay, if they have dentures. You also may need, if the resident has dentures, a denture cleaning tab, so that you can, an effervescent tablet that you put in for cleaning dentures. And basically what that is you would put water in your denture cup, okay, and you would put one of these tablets in the water, and then you would put the dentures inside and put the cover on, and that effervescent, it bubbles, okay, it would clean the dentures, okay. You may need denture adhesive cream in order to put the dentures back in your patient and have them sit right, okay? If you're not using the effervescent cream, you may be using a special toothbrush, and this is what a denture toothbrush looks like, okay? It's got 2 different sides to it, okay? One so that it can get inside of the gums of the denture, and one to brush the teeth, okay? And that you would use whatever toothpaste your resident wanted or your facility supplied. So then for that. If your patient has their own teeth, you would have a toothbrush and a toothpaste just like you use at home, right? Okay. And we also need an emesis basin, and this is what an emesis basin looks like. It looks like a kidney bean, okay? It's used like this, okay? It's put underneath the chin and they spit into it, okay? So that's the reason why it's rounded, so it goes against the face, okay? All right, so gloves or no gloves, what do you think? You're right. You're going to be touching the mouth, so you need gloves. Very, very good. Okay, so we've gathered our supplies and we've performed WIPSA, okay? We place a client in a sitting position in adjusted bed to comfortable working height position. If they're in the bed, raise it up to your waist so that you can work with them comfortably and save your back. If not, they're in a seat, okay? Our guy's in a seat, okay? So we're going to provide evening care to this gentleman, okay? We assess him for pain and offer toileting to promote his comfort, okay? We provided assistance if needed or request a bath. So if the patient or it's time for a bath, we would assist with that, okay? We provide mouth and dental care as needed. So I'm going to show you both ways, okay? All right, so we would have our gloves on. Okay? And let's say that this patient has dentures. So we get our denture cup with their name on it and make sure that there's cold water in here. Why cold water, not warm water? Warm water, you say, might clean things better, but cold water keeps the dentures from becoming soft. The warm water may actually loosen or make these gums not as hard, and it could misshapen the dentures. So we don't want that to happen, okay? So we want cold water. And so when you are removing dentures from a mouth, now remember, I'm working with a mannequin who he's not flexible and does not assist with anything, okay? So it may look like I'm manhandling him. You are not to manhandle your patient, okay? It's just a simple, this is the top denture. This is what a top denture looks like. Whoops, okay? Looks just like this. Looks just like the top of your roof, of your mouth, yes? Okay? So that's the top. This is the bottom dentures, okay? So, see how it's, this works right along the gums that are left in their mouth, okay? So this is the bottom denture, okay? So, removing them, I always find it easier to work with the bottom denture first and then the top, okay? So remove the bottom denture and put it in the cup, and then you're going to reach up under the lip and pull down on this little piece right here, okay? Pull down on it, and it should break the seal on the roof of the mouth. And you're going to put that in the denture cup, okay? And you're going to put the cover on it. Why are you going to put the cover on it? Because you don't want that dumping on the floor, because if that dumps on the floor and those dentures break, your facility has to buy this patient a new set of dentures. And they are very, 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 very expensive, okay? Oh, before we did that, we really should have put a towel. Forgot about that, sorry. We should have put a towel down here to keep food or spit or anything that comes out of the mouth off of the client, okay? So put the towel there. And when we remove the dentures, they may have had a little bit of spit that came out. You could easily just, wipe off their mouth. Now, you can assist the client to do mouth care at this point, or you could wash the dentures. Either way, it doesn't matter, okay? And washing oral care is as simple as either water, swish it around, spit it out into the spittoon, and wipe the mouth, okay? Or mouthwash, whatever they're dependent on the facility and the patient, okay? So you pour a little bit of mouthwash into their mouth and have them swish it around and spit it out. And then wipe off their chin, okay? At this point, you go over to the sink. So I'm at the sink now, and I'm going to wash the dentures, okay? So what you want to do is you want to take a washcloth, a paper towel, or some sort of soft cushion and put it down into the sink, okay? That serves as a barrier in case you drop the dentures and you don't want to break them, okay? So what you're going to do is you're going to empty out the water, okay, rinse them off and empty out the water again. You're going to take your nifty little denture cleaner, okay, and you're going to take your toothpaste and put it on both sides, okay, and then you're going to take the small side and clean the inside of the denture gum, okay, clean it really good. And then the big side is to do the teeth, okay, so you're going to brush the teeth, you're going to get all surfaces, okay, you're going to do the in and out, okay, you're going to rinse that off, okay. You're going to take this other dirty one, put it in the sink, rinse this cup, okay, put some clean water in, rinse off the top, and put the top denture back in the cup. Got that? Okay, you take the bottom denture out, put that in the sink, rinse the cup, dump it out, put some clean water in. Rinse the top denture off under the running water, cold running water, and put it in the denture cup, okay? If you need more toothpaste, put it on, okay? Again, you're going to take and brush the bottom denture. Brush it good, okay? Clean them good. Get all that yuckies out of there, okay? Wash it good, okay? Rinse those off and put that in the denture cup and put the cap back on. Whenever you're walking across the room, you should have the cap on, okay? So then we go back to the patient, okay? Then we walked back over to the patient, okay? And then we're going to assist him with putting the dentures back in. So again, work with the bottom dentures, okay? You want to put in, oh no, excuse me, insert the top denture first. I'm sorry. You want as much room as possible. Please pardon me. You want as much room as possible in the mouth to finagle the big piece, okay? So what you're going to do is you're just going to push it in and up onto the patient's mouth. They'll be assisting you too, remember, okay, with their tongue. They'll be pushing that back onto place, okay? Now, if by chance they like the denture cream, okay, you would have put it along the whole top of that gum, okay? So you would have put it, let's see if I can get these out of here again. Remember, you're not manhandling your patient like this, okay? Okay? So if they wanted denture cream, you would have put it all in here, okay? Put the denture cream and then finangled it into their mouth, okay? They would have been pushing with their tongue too, would have helped. And it wouldn't have slid down their throat like the mannequin's is right now. And assist it back up into place. And of course, because I want it to go into place, it's not going to, right? All right, let's try again. There, back up into place. And they'd be pushing with their tongue and pushing that back up into place, okay? You take the bottom denture, put the denture cream along the inside of that gum line, okay? Put it in sideways so you get it all in the mouth. Again, the patient would be helping. The mannequin does not bend very well, okay? And then you put it in to place, tongue out of the way. And then his teeth are back in, okay? So that's the oral care for a client with dentures. So now your client has teeth and you have to provide, see now the teeth are not gonna work. So let's put this pauses for a moment. Okay, so now our client has teeth and you need to assist with brushing. So you could, easily wet the toothbrush with just a little bit of water from your cup, right? You'd put a little bit of, you'd put some toothpaste on your toothbrush and you would either, give it to your patient and allow them to brush or help them brush, or you could brush their teeth. You're gonna brush it just like you were brushing your own teeth, okay? You wanna make sure you get the top of the teeth. You wanna make sure you get behind, underneath. Make sure you brush the tongue and the sides of the cheeks and the top of the mouth and the gums. You want to make sure you get all that. That's all important oral care, okay? So you get done brushing and now it's time to rinse, okay? So you give the patient a little bit of water, they swish it around, they spit it into the spittoon and you wipe their chin, okay? If they prefer mouthwash at this point, you do the same thing. Pour a little bit into their mouth, they swish it around, they spit it out, and then you can wipe their chin as well, okay? So that is oral care. At this point, we would remove and discard our gloves and we would perform hand hygiene if we were done with the oral care of our patient. Before we moved on to performing morning or evening care. So evening care, we're going to remove things that are on our patient, okay? So we're going to remove equipment. We're going to remove the extra linens and extra pillows from the bed. We're going to remove the stockings and ace wraps and binders that we placed on our patient, okay? At this point, we may change dressings if it's supposed to be done before bed, okay? We would perform any required procedural techniques at this point before, putting them to bed. We'd wash their face, hands, and back of the client as needed if that's what's required. Again, we could very easily be using a pre-made kit or a wash basin with soap. We could perform a back massage before bed, okay? Combing and brushing the hair. Some people like to do that before they go to bed. And so those are all things that we would do to put them to bed. Now, they may also have an order for sequential compression devices, or SCDs, and those are just sleeves that go on the lower leg, and what they do is they give the leg a massage. It's air, and it fluctuates within the sleeve itself, and it kind of helps to, well, it doesn't kind of, it helps with not developing blood clots, okay? So they may have an order for those at bedtime, so we would put those on. At bedtime, in the morning, we may be putting on stockings or binders. You'll learn all that later, okay? You will, okay? Trust the process. And you would replace soiled linen or straighten and tuck the remaining linen on the bed in the morning, okay? You may not do a complete bed change. It may be just replace what is needed, okay? Or just straighten it up. You would also make sure that if it is the morning or night, either one, you make sure they always have the call bell within reach. Always have the overbed table by them with their water if they're able to have water, and reading material, or if it's a male and they're able to use the urinal by themselves, the urinal inside of a chuck so that they can use it, okay? If it's bedtime care that you're giving, make sure, if they have a sleeping pill and they ask for it, that you get it for them, okay? You make sure that they're comfortable and safe. You'd raise the side rails if you're supposed to. Make sure that the bed is down in low position at all times, okay? You dim the lights at nighttime. You may open the shades for the day if it's daytime care. And then if you had gloves on, you would remove your gloves, you'd clean up all of your materials, and you would perform hand hygiene. So that is skill 2.3. Okay, and I'm going to pause for a moment and I'll be right back. Alright, so we're back to do skill 2.4. Providing special oral care for a client who is unconscious or debilitated. Debilitated means unable to, do a whole lot. Okay, that's the simple term. Okay, peeps? So what do you need to do this? You would gather your supplies. What supplies would you need? First of all, gloves, right? Oral care, gloves, right? Okay. You would need suctioning. Why would we need suctioning? Okay, so they're unconscious, they're not able to swallow the secretions that, or the liquid that we're going to be putting in the mouth, okay? Or debilitated, they have impaired swallowing, meaning that they may try to swallow, they can't, and then what happens is that liquid could go down into their lungs, and we don't want that, right? Because that would cause pneumonia. So we want Yankar in suctioning. So this is what a Yankar looks like. It's an opening at the end, okay? It's connected to the suctioning device so that we can suction out fluid, debris, or whatever within our patient's mouth, okay? So we need that. We'd need a towel. Okay, why a towel? Because we're going to put it down, keep them clean, right? We may, a swab or toothbrush. Okay, so let me talk to you about the swabs and toothbrush. Toothbrush, if they're able to, they just can't brush themselves, and, we're able to get in there and brush. But new new in the line of taking care of debilitated patients is what we call